Would insurance cover my treatment? That was one of the biggest worries when making the transition to VUMERITY. I worked closely with Biogen Support Services, who guided me through the process and helped me to determine that I was eligible for the Biogen Copay Program, which over the years has been a huge help with managing my VUMERITY costs.
Not everyone knows about Biogen's Copay Program. It can help them get access to treatment that might be right for them. I encourage everyone who is on VUMERITY to contact Biogen Support Service to learn more.
What is VUMERITY? VUMERITY is a prescription medicine used to treat people with relapsing forms of multiple sclerosis, MS, to include clinically isolated syndrome, relapsing-remitting disease, and active secondary progressive disease in adults. It is not known if VUMERITY is safe and effective in children. Important safety information. Do not take VUMERITY if you have had an allergic reaction, such as welts, hives, swelling of the face, lips, mouth, or tongue, or difficulty breathing, to Diroximel fumarate, dimethyl fumarate, or any of the ingredients in VUMERITY. Are taking dimethyl fumarate. Before taking and while you take VUMERITY, tell your healthcare provider about all of your medical conditions, including if you have liver problems, have kidney problems, have or have had low white blood cell counts or an infection, are pregnant or plan to become pregnant. It is not known if VUMERITY will harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if VUMERITY passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby while using VUMERITY. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What should I avoid while taking VUMERITY? Do not drink alcohol at the time you take a VUMERITY dose. What are the possible side effects of VUMERITY? VUMERITY may cause serious side effects, including allergic reaction, such as welts, hives, swelling of the face, lips, mouth, or tongue, or difficulty breathing. Stop taking VUMERITY and get emergency medical help right away if you get any of these symptoms. PML, progressive multifocal leukoencephalopathy, a rare brain infection that usually leads to death or severe disability over a period of weeks or months. Tell your healthcare provider right away if you get any of these symptoms of PML. Weakness on one side of the body that gets worse. Clumsiness in your arms or legs. Vision problems. Changes in thinking and memory. Confusion. Personality changes. Herpes zoster infections. Shingles, including central nervous system infections. Other serious infections. Decreases in your white blood cell count. Your healthcare provider should do a blood test to check your white blood cell count before you start treatment with VUMERITY and while you are on therapy. You should have blood tests after 6 months of treatment and every 6 to 12 months after that. Liver problems. Your healthcare provider should do blood tests to check your liver function before you start taking VUMERITY and during treatment if needed. Tell your healthcare provider right away if you get any of these symptoms of a liver problem during treatment. Severe tiredness, loss of appetite, pain on the right side of your stomach, have dark or brown tea-color urine, yellowing of your skin or the white part of your eyes. The most common side effects of VUMERITY include flushing, redness, itching, or rash, nausea, vomiting, diarrhea, stomach pain, or indigestion. Flushing and stomach problems are the most common reactions, especially at the start of therapy, and may decrease over time. Taking VUMERITY with food, avoid high-fat, high-calorie meal or snack, may help reduce flushing. Call your healthcare provider if you have any of these symptoms and they bother you or do not go away. Ask your healthcare provider if taking aspirin before taking VUMERITY may reduce flushing. These are not all the possible side effects of VUMERITY. Call your healthcare provider for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. For more information, go to dailymed.nlm.nih.gov. Please see full prescribing information, including patient information, via the link provided. This information does not take the place of talking with your healthcare provider about your medical condition or your treatment.